Whether it's sawing logs, blowing Z's, revving the chainsaw, we all know someone that snores. You may even be that person. But what happens when our children snore, and is that important? Hi, my name is Ortiz. I'm coming to you with today's Healthy Bites, and I'm one of the sleep physicians here at JohnsHopkinsAllChildren'sHospital, and I wanted to spend some time to talk about snoring and sleep apnea in children. When you think about snoring and obstructive sleep apnea, think about what we call the upper airway, and this includes the nose, the back of the nose, the mouth, the back of the mouth, where those two structures meet up before going down your throat to your lungs. These structures are lined with a lot of soft, squishy tissues and are normally maintained open by the muscles of the upper airway. When we're awake, these muscles are active and nice and open. Problems will come when we fall asleep and these muscles relax. Now, normally, when the muscles relax, the airway is collapsed, but it's still open enough for air to go in and out with any problems. However, with snoring, the collapse is so much that when air transmits through these collapsed spaces, this causes vibration of that soft, squishy tissue, leading to what we call snoring. About 1 in 4 kids will have some mild intermittent snoring. This may happen when your child has a cold or allergies are acting up. As long as it's soft and very infrequent, this is not normally a concern. However, if your child has regular snoring, about 3 times a week or more, then that could be concerning for obstructive sleep apnea and primary snoring. Most concerning is obstructive sleep apnea. And this is when there's so much collapse of the tissues and muscles of the upper airway that the body cannot support the body's air needs. This usually results in a sudden stop in breathing, sometimes with a sound that we call an apnea. Sometimes these apneas can be silent and basically we just hear nothing, and sometimes they can be kind of in between snoring, like your mileage may vary, but it can be, again, very quiet or very loud, but there's always a pause in breathing. Up to 6% of children can have obstructive sleep apnea, and obstructive sleep apnea in children has been associated with impaired brain development, decreased academic performance, abnormal metabolic changes, among other problems. In adults, obstructive sleep apnea has been associated with increased cardiovascular disease, hypertension, and stroke. But how does this look like in real life? In younger children with obstructive sleep apnea, sleepiness may not be a problem. They may wake up cranky, but they may have issues with hyperactivity and inattentiveness. If they're in school, they may not be doing so well in school because their ability to focus and pay attention is decreased. If you have a teenager or adolescent with obstructive sleep apnea, they may have symptoms of sleepiness just like you would expect in adults, but they may also have issues such as anxiety and depression. There's another situation that isn't exactly that intermittent snoring or obstructive sleep apnea. That's called primary snoring or habitual snoring. This is a situation where a child snores regularly, maybe 3 nights or more a week, but on a sleep study we don't necessarily see sleep apnea. Previously it's been thought that this might be a benign process, but more recent studies have shown that snoring in and of itself may be harmful to the developing brains of children. As mentioned earlier, snoring and sleep apnea happens when air cannot freely travel through the upper airway. But why? Well, in some kids, there may be actual inflammation of the upper airway that creates swelling so that there's not enough space for the air to travel through. This can result from acid reflux disease, allergies, or even smoke exposure. Other times, children may have enlarged tonsils and adenoids. These are some of those soft, squishy tissues that I've been mentioning earlier. And removal of the tonsils and adenoids has been shown to be very effective in treating, if not curing, obstructive sleep apnea in young children. Obesity is becoming a bigger and bigger factor in developing obstructive sleep apnea in children. Normally, obesity is considered a factor for developing sleep apnea in adults and in older teenagers. However, about 1 in 3 obese children will develop obstructive sleep apnea. This is thought to be secondary to deposition of fat along the structures of the upper airway, leading to easier collapse. Obese children are less likely to be cured from surgeries to treat obstructive sleep apnea. There are other factors that contribute to developing sleep apnea in children, and this can include things like facial structure, size of the tongue, how relaxed those muscles get when you fall asleep, as well as many other undetermined factors that have not yet been discovered yet. Additionally, taking certain substances that can relax the muscles or the upper airway can also contribute to the development of sleep apnea. About 20% of kids with sleep apnea may not have observable snoring by the parent. A lot of factors can go into this. The main one can be that the child may be snoring when the parent's asleep. So even though you may not hear your child snore, we may hear your child snore when you bring them into the sleep lab for a sleep study. Additionally, there could be other signs of obstructive sleep apnea that may not be obvious, such as gasping during sleep or looking like your child's working hard to breathe at night. Waking up with a sore, raspy throat can also be a sign that there's some upper airway obstruction. Myth number 2, my child isn't overweight or obese, so they can't have sleep apnea. While obesity is becoming a bigger and bigger problem in developing sleep apnea in children, that's not the only factor that goes into having sleep apnea. Issues such as facial structure, like having a very thin face or a very crowded mouth, a large tongue, or big tonsils and adenoids can also contribute to developing sleep apnea in children. Myth number 3, my child appears fine. I don't think I need to get them checked out. Some children and some adults may be very resilient against the stress of disrupted sleep that obstructive sleep apnea can cause. But eventually, this stress will eventually catch up. Before you decide not to consult your doctor about your child sleeping, think about what's going on during the day. Are they hard to wake up during the day? Are they easily irritable or hard to follow directions? Are they doing okay in school? These could be subtle signs of obstructive sleep apnea affecting your child's developmental performance during the day. Sleep has so much influence in our lives and health, and snoring can be a warning sign that obstructive sleep apnea is present. Getting diagnosed and treated for obstructive sleep apnea can prevent future problems in the health of our children. Thank you for joining us today for today's Healthy Bites, and I hope you and your family sleep well.